Hello, and welcome to our show. We're so glad you joined us today. We have a great topic on For the Love of Animals. We're going to be discussing shelter medicine. I'm Darlene Pigford.
And I'm Greg Bauer, and I'd like to tell you about a couple of upcoming shows. We'll do one on horses and one on hummingbirds, and I think our viewers will be really interested in those shows. But now you've whetted my appetite, Darlene. What's on tap for today?
Well, I'm going to be learning, along with the audience, Greg, something about the degrees of help in shelters for the common illnesses and problems that are presented.
Okay.
Strictly because animals, you know, are
Sure.
collectively in cages or pounds or whatever.
Yeah.
So introduce our guests.
You know, it presents a unique set of problems.
Yes,
There's
it
no
does.
question about that. Oh, I might just mention too, our couple of animals, Angie and Wicked, are not with us today. They've taken the day off.
Yes, yes. They're at home watching.
Because we have with our guest today, she has brought her dog. Our guest is Dr. Bonnie Jones, who's a veterinarian here in Paducah, and she has her little dog Gidget with her, and you're going to hear more about Gidget in the Happy Tale. So welcome, Bonnie. We're so glad you took time out of your busy schedule to join us today.
Thanks. It's a pleasure to be here.
Thanks for coming. Well, tell us about your fur family, both here and at home.
Well, right here we have Gidget, and she's about 5 months old. She came into my clinic as a little hairless puppy who had such a severe skin problem that she couldn't open her mouth to eat, and when she walked around, she would leave little bloody footprints. And the family who had adopted her from the rescue group that she came from, once they realized the degree of care that she was going to need, weren't able to keep her anymore. And we actually had made the decision to put her to sleep, and she ate a hot dog out of my hand, and now I own a dog. So she's been living actually at my veterinary clinic until she could get over what she's been dealing with and get healthy again. And this is actually her first time on TV.
Oh, she's doing great.
I also have at home a St. Bernard and 2 cats.
Oh my goodness.
And we're going to hear more about the St. Bernard later also.
Okay. Well, I understand that one of your specialties, Bonnie, is shelter medicine. Now that's kind of a new term. What is shelter medicine?
That's a really good question. Shelter medicine is a branch of veterinary medicine designed to address the special health needs of animals within shelter settings, both from a collective perspective at what needs to happen at the shelter level, and also in the individual animals' cases. So there are now a few residencies in the country where you can actually get board certification in shelter medicine. And then there are special interest groups as well, and that's what I'm part of. The most common one is called the Society of Shelter Veterinarians.
Okay. All right, and so what are the common problems that you as a veterinarian in shelter medicine might be dealing with, say, in a local shelter?
Well, it varies a lot day to day. In kitty cats, we frequently see things like upper respiratory infections, so things like colds and snotty noses and gooey eyes. In dogs, we can see things like kennel cough, infectious diarrheas, and things like that. Certainly, parasites can be an issue in shelters. There are also more common viral diseases that we can see, parvovirus in dogs, leukemia in cats, and all sorts of other things as well. And there's some specific viruses that we deal with from time to time. But basically, anytime you take a bunch of animals from a bunch of different sources, many of whom have had suboptimal care, and put them all together, you can run into some issues. And I just want to say, in Gidget's defense, the cameraman just took a big long stick and tapped Greg, and that's why she's growling. So she's defending us.
Bless her heart.
Good for you, Gidget, but it's
okay,
all right.
Oh.
And these problems, like you said, they come individually when they came in, but when they get together collectively, seems like a virus or upper respiratory would just spread like wildfire.
Exactly, and that's really the issue, is we have a lot of animals in a small space with a lot of stress, which certainly weakens their immune system, and it can be a recipe for disaster if there's not very proactive management of health care in the shelter.
Yeah.
Okay, so no, it's like if you've got 1 or 2 little problems, when you put all these animals together, they just increase exponentially and just get much, much worse. Yeah. So.
Well, and unfortunately, in a shelter, it's one of those catch-22s in a sense. You have to have them there because they need assistance, but they're there, and it creates more problems.
Exactly.
So.
But now these problems, I mean, what your shelter shelter medicine idea is they can work on these, right?
Right, and our whole perspective is one of prevention and sort of a herd health style of management. We borrow a little bit from the large animal people in veterinary medicine. And so one thing that I've worked particularly hard on is establishing intake protocols and management protocols within the shelter to prevent diseases or contain them before they ever become that epidemic that results in disaster.
Okay. Well, what might be, well, like, say for cats, your cat is brought into a shelter, and obviously it needs food and water and a litter pan. What protocols would you recommend to control or prevent some of these problems?
Sure. Ideally, what you want to do is cats, as soon as they walk in the front door of a shelter, should receive a vaccine up their nose for some of the more common respiratory viruses. There's been evidence that gets them protection within a day or two, and that can really cut down on disease outbreaks. We also would recommend testing for feline leukemia and FIV, which are two potentially fatal illnesses that certainly affect the cat's immune status and can affect their ability to be placed as pets into a home. Taking care of any parasites they may have, fleas, ticks, deworming, things along that line. And then you don't want to take a cat and throw it into a room full of kitty cats who've been there for months. What you should do instead is contain the cat, generally for 2 weeks, in a holding zone. And that way, if they're carrying any diseases that haven't shown up clinically yet, you have time to catch them before they're mixed with the general population and spreading those germs around.
Okay. And these are things that a person in the shelter can be trained to do. Exactly.
It doesn't take a veterinarian. Once you've got a protocol set up, it's very easy for lay staff to follow.
Okay. Well, we've covered the subject of cats, and we want to look at dogs, but at this point we want to take a break to listen to a happy tale. And Gidget, listen up, because this is a story about you.
Gidget?
Okay.
Gidget, so, you're the star, so listen up.
We think you'll enjoy this.
This is Gidget, a 5-month-old female puppy. Gidget isn't sure what breed she is, but she weighs about 30 pounds. Gidget was a stray, and some nice folks brought her to Dr. Jones because she had some type of skin condition. The people who brought Gidget to the vet didn't have the ability to keep her. After some treatment, Dr. Jones said that Gidget's skin problems are getting much better, and she'll soon have a new home with Dr. Jones and her family, as well as a doggy playmate named Lucy. Gidget loves to eat and likes to play with toys, so Dr. Jones gives her little toys that have food in them. Getting the food out of the toys is a challenge, but Gidget loves the reward. Gidget is so happy that she will have a happy, loving, and forever home with the Jones family.
Welcome back. We hope you enjoyed that little story about Gidget, and of course she's one of our live guests here today. So she's a fascinating little dog, and I know that you enjoyed that story. One of the other things that can happen, and we're going to talk more about this during the show, is fleas and ticks can be a real problem at home or in a shelter, whatever. And we'd like to remind our viewers that we have done a show on flea and tick control, and you can find that show on the web at our website, www.paducah2.org/video clips/animals. And given the situations as they occur during summer months and so on, we know that that'll be helpful. But those are problems that occur all year. So we're talking right now with Dr. Bonnie Jones, and we have been looking at a little bit with cats some of the common problems we have. Bonnie, what about dogs?
Dogs are a little bit more interesting. Well, that's not true. Cats are fascinating.
Yes, they are.
Dogs are a little bit more overt in some of the problems they have. They can certainly have issues with infectious disease within a shelter, not uncommonly at all. But one of the biggest concerns for me as a shelter veterinarian is the behavior issues that can come up with a dog when they're placed in a shelter. It's a very high stress and high anxiety environment. Many dogs are surrendered because of a behavioral problem that may or may not be disclosed when their owners do bring them in. And once they're in a shelter, that can really be magnified. So it's a whole different level of care and analysis that the shelter staff has to do with a dog. Because a cat who's anxious and nervous hides in the back of their cage. A dog who's anxious and nervous may attack someone who walks by. So it's a very different way of manifesting that stress from being in the shelter.
Okay. And if a cat isn't, you know, if it is stress and you try to clean its cage, it growls and, you know, just like a dog.
Sure.
So, but what are some of the common physical problems? Like you mentioned, Gidget's skin problem.
Well, that actually is not a particularly common problem in shelter. She has a type of skin mite infestation called demodex or demodicosis, and that's a common problem in puppies, pregnant animals, and things like that.
Is that related to mange?
It's a type of mange. The old timers called it red mange.
Oh, okay.
But it's very treatable and very manageable, but it is a long-term commitment of medications and can take several months to resolve.
Is it contagious with other animals?
It is not. There is there's another type of mange that is, but demodex is a problem just of the specific animal. The things we worry about more from a shelter management perspective are things like parvovirus in puppies. There have been outbreaks of canine influenza, although none locally lately that I'm aware of, but that can kill every dog in a shelter very efficiently. And certainly things like parasites, fleas and ticks and worms, if they're not addressed proactively, can become a problem within the shelter as well.
Yeah, and heartworms I know is a particularly expensive treatment.
Heartworms are a very expensive disease to treat and a very easy disease to prevent, as I'm sure you guys know and probably have spoken about.
Don't they come from mosquitoes?
Yeah. They're transmitted by mosquitoes. We recommend that all dogs and cats be on a preventative medication once a month to keep them from getting infected with heartworms. But if a dog is in a shelter and is heartworm positive, that's very important information to have, because treatment can cost hundreds of dollars, and while it can be very expensive, and it's something that you definitely want to know before adopting a dog out. It's not a death sentence, but it's very important information to have. So as far as sort of a baseline information for any particular shelter dog, I think a heartworm test status is very important.
Well, I'm very glad you're late. Project Hope here in Metropolis have many vet bills because they have taken the dogs that had excuse me, the virus we just talked about, heartworms, and they got treated. And so when they did go out for adoption, I mean, it was on their record, but you know, they were able to get rid of the heartworm.
That's terrific.
Yes, because it took many trips. And is it a shot they have to have?
It's a series of 3 shots, and they're given basically a month apart. But for 2 months, the dogs have to be rested strictly, because as the heartworms die, any increase in activity or heart rate can cause, there goes your cameraman again, it can cause death if the dog is overactive. So it's not undertaken lightly.
Yeah, okay. So there really are many things for a shelter to do other than to feed and water,
exactly.
Right?
Right.
Okay.
And I think it's important to realize too, by being proactive up front, shelters can actually save money in vet bills and in disease treatment later by preventing them.
Well, that certainly does make a lot of sense.
Does.
So, okay, you brought up the stress issues, and I think this is something I didn't understand until Greg and I started doing rescue work. Tell us more about the stress issues with both cats and dogs.
Well, I could talk for hours about that.
I'm listening.
But you know, in very short matter, cats in particular don't do well when they're removed from a familiar environment. So walking in the door of a shelter which has all these unusual smells and sounds and tons of cats and people they don't know, it can be very stressful, and a cat will generally respond in one of 2 ways. They'll become aggressive out of a defensive mechanism, or they may just become withdrawn and hide, not eat, and get depressed. So those are things we really want to watch out for, and there are a lot of ways to prevent that in a shelter. As far as dogs, again, how they're housed, what they're looking at, what they're hearing through the day can make a huge difference in their stress level. 2 dogs who are staring at each other through a fence may get aggressive just because of that frustration, whereas dogs who are maybe situated a little differently can have a much more relaxed experience. And obviously human interaction is huge. If you have volunteer dog walkers who can get dogs out a few times a day for exercise, just like us, they're going to feel better as opposed to being stuck in a cage all day.
Oh, I can't think of anything worse than being stuck in a cage. In fact, there's certain pets that haven't gotten adopted, and they've been in shelters for years, in no-kill shelters, and that's weighs heavily on us dog and cat lovers' hearts. I guess that's why we have such a zoo at home right now. So,
well, what are some of the things that you can do to help eliminate this stress and help that animal who's just come into the shelter brand new to maybe make themselves feel a little more at home?
Well, one thing is understanding that there's a normal adjustment period that animals need. Your viewers don't know this, but obviously when Gidget and I arrived at the shelter today, or the studio,
Okay.
she was barking and growling and hiding behind me because it was a new place and she was frightened. Magnify that, by 100 times and you get the idea of a dog walking into a shelter. So having staff who are educated as to what normal behavior is and how to help those dogs along is huge. It's simple environmental enrichments, having toys to play with, hiding their food into toys they have to work it out of, giving them something to do to keep their minds engaged, paying attention to what dogs you have close to each other and knowing their personalities. Anything like that can really, again, improve their experience and try to eliminate some of those anxiety-based problems that we do see.
And particularly if an animal has also been mistreated in some way.
Absolutely, and that's very common in shelters. You'll have dogs particularly come in who are, for example, terrified of men or terrified of children because they've had bad experiences in the past, and they don't understand that not all men are scary and not all children pull their tails. So the more we can know about their history, the better they can be cared for.
Yeah, and that works fine, except for when the stray comes in off the street that somebody brings them and nobody knows where they came from. But, so it's a by guess and by golly at that point.
Right,
but,
and it can be very challenging, and at that time you just have to use your common sense and some patience and as much training as you can get.
Okay. Well, we're just
my word.
moving right along and getting a lot of wonderful ideas, Bonnie. But we want to take another short break, and we have another happy tale, and this is about a very special Saint Bernard named Lucy. And we know Bonnie can tell you a little bit more about her after the break. So give a listen.
This is Lucy, a 5-year-old female Saint Bernard that weighs about 100 pounds. When Lucy was only a few months old, some folks brought her to Dr. Jones, who thought that Lucy had a hip problem. The people who brought Lucy in didn't want her, so she came to live with Dr. Jones and her family. Lucy loves to eat, especially vegetables, and she loves to play with the family's youngest son. Sometimes the family jokingly says that Lucy is not very smart, and they tell people that she flunked doggy kindergarten. But Lucy is smart enough to realize what a good thing she has. Her favorite pastime is sleeping on the master bed when the family is at work and then pretending that she didn't do it. Lucy is looking forward to soon having a new doggy playmate named Gidget. Thanks to the Jones family, Lucy has a happy forever home.
Welcome back. We hope you enjoyed that little tale about Lucy, and we're visiting this afternoon with Dr. Bonnie Jones, and we'll return to our visit with her in just a second. But again, we want to remind our viewers that with fleas and ticks being the way they are as usual in the summer, take a look at our show on flea and tick control. You can find that at www.paducah2.org/videoclips/animals. And there's a lot of other shows I think you'll find interesting topics on there too. Well, as I mentioned, we're visiting this afternoon with Dr. Bonnie Jones, and we're talking about the topic of shelter medicine. And we've just been finished talking about stress. Was there anything else we'd like to add about stress, Bonnie? That I think we've pretty well covered it, haven't we?
I think we've definitely given a good overview. It's a huge topic, and it's one of the biggest areas in shelter medicine. So it's certainly something that if individuals or shelter staff are more interested in, there's a lot more information available.
And if others want our viewers want some more information about it, Bonnie, how can they contact you to find out more?
I can certainly be reached at Flannery Veterinary Clinic, and the number there is 898-9738. And there's also some good resources online. The Association of Shelter Veterinarians has some excellent guidelines that have been set forth for shelters. And even for lay people, those can be helpful as far as giving an idea of what a good shelter, a well-run shelter should be doing, and give them a lens through which they can view shelters they're considering adopting pets from.
Yeah, okay.
I'd like to go on this idea of stress. I knew that cats like to be, to be high up, like to climb. But I didn't understand the importance of that. And when most shelters have, or some shelters have cats in horizontal cages. How should cats be housed?
If money and space permit, ideally it's nice to have an elevated perching area for cats. And it's also nice if you can separate the litter box area from where the food and water are.
Absolutely.
It's also really nice if cats can have something as simple as a cardboard box or a little blanket that stays in their cage all the time. It's only removed if it's really soiled, because that allows them to have a familiar scent. They'll often mark those with their faces and do a little rub like this, and that deposits pheromones that help to decrease their anxiety levels.
All right, now, pheromones. Tell me a little bit more about. I'm not.
So pheromones are basically molecules that we can't detect with our noses, but all animals release them, and they have different effects on our physiology. For cats, the most common one and the most important is what they call the facial pheromones. And again, these are the things that when a cat rubs against your ankles or on the corner of your home,
of your wall,
they're depositing these pheromones. We don't smell them, but their little brain chemistry systems process these chemicals, and it has some very interesting effects. As I said, in kitty cats, it can decrease anxiety, decrease urine marking in a household, and things like that. So little tricks like that, and there are synthetic versions of those pheromones available. They're a little bit pricey, but it costs almost nothing to leave the same blanket in the cat's cage for its entire shelter stay. So those are very simple things, and again, where a little bit of training for shelter staff can go a long way.
But it would take the time or volunteer to take that particular blanket, wash it, and then return it to the cage.
Nope, we're not washing it. We're just leaving it right there. If you wash it, all the good stinky cat stuff is off.
Oh, okay.
And they have to start over again.
So I got
exactly.
Okay, I'm with you now.
Only wash it if it goes to another cat.
You got it.
or if they spill their food, or
Sure.
little accident, they throw up hairballs, that kind of thing.
Exactly. If there's a mess that needs to be dealt with, that's one thing. But again, it's just a change in mindset of being a little bit more sensitive to feline psychology, and remembering that cats are not small dogs and need to be handled and housed differently.
The psychology of cats is fascinating. I would love to talk with someone who really understands it, but I don't think that person exists.
Yeah, you and me both.
I do think that cats need fresh air and sunshine, and it would be nice, if they had like a kitty porch.
Sure.
It would take time, but I do know, like dogs, some shelters will have it where they have a run, or either they're walked twice a day. Is that helpful or what?
Well, walking a cat on a leash can be a tricky
a dog.
endeavor.
A dog.
Dog, yes, I'm sorry. Absolutely. Getting out for a couple of times a day, particularly on a leash with a person and getting that interaction as well as exercise, is just so valuable for a shelter dog. And the nice thing is that's a pleasant experience for people as well. So it's a very good way to utilize volunteers. It doesn't add to the shelter budget, and everybody wins.
Yeah. No, what I meant before was just as dogs are walked and like to get out, cats like fresh air. They need fresh air and sunshine. And when they're just in a cage all day long, they need a kitty porch, in my opinion, just like dogs need to be walked.
Well, that becomes a difficult balance, only because ideally, yes, but we're always balancing the needs of the individual, again, against that disease containment. So for example, the shelter I used to work with, as long as everybody was healthy, the kitty cats did get a walkabout every day, and they could go out into a screened outdoor enclosure. If there was, for example, a respiratory disease outbreak, which we didn't have many of, but if there was, everyone was on kitty lockdown, and we stopped those walkabouts to end disease transmission. So it's always a balance, but I think having that as a goal is great, as long as it can be accomplished within that setting.
I like the phrase kitty lockdown. Now, you've highlighted, the problems that we can have in shelters because they're put there as a group, perhaps. We certainly don't want to leave the impression that shelter animals are so much of a problem that we shouldn't adopt, right?
Absolutely not. And I have so many clients who come in and say to me, Dr. Jones, what breed of dog should I get? And I always say, you need to go down to the animal shelter and say, I want a mid-sized, middle-aged, mid-range dog. And they tend to be the healthiest, most pleasant animals. Obviously, they're coming with a little bit of an unknown past in a lot of cases, but they just make delightful pets. And I've known very few people who only have one shelter pet. It seems like once you've had one, that's your default from then on.
We are perfect examples of that.
Well, I've just noted, like Gidget, she just was brought into a brand new environment, and she's had to get used to so many different people, and she's just seemed to have calmed down right now and is giving us good eye contact. She seems to I've just noticed that improvement, in her. So, but you've been very, okay. I'm talking about you. I'm talking about you, sweetheart. What guidelines, if I wanted to, I'm going to a shelter and I want to adopt a cat or a dog, what guidelines would you give me? What questions should I ask?
Well, I think it's always important to know what has been done for these animals. What testing has been done? What do we know about the pet's past? In many cases, we don't know anything, but sometimes we do. Have they had any health problems now? Are there any problems in the shelter? And then also knowing what are my options for follow-up. Does the shelter offer any behavioral training classes, support if there's an issue when a shelter pet comes into a home? But I also think using some common sense. If you walk into a shelter and it smells clean and fresh and the animals are well cared for, that's a really good sign. And if you walk into a shelter and it's dirty and dark and stinky, that's not such a good thing. And that is not to say that the animals being adopted from it might not be wonderful pets, but it's just something to keep on your radar and realize that you may be dealing with some other issues there, and really making sure you have the best information that you can.
Well, the best thing is to volunteer and go in there and help them to
Absolutely.
Give them the help so that as they are feeding and all that, may be, many times there's just not enough help at a shelter.
And let's be clear as well, help is incredibly important, and you know what, so is money. So certainly supporting shelters with both your time and financial donations can be so important.
Yes, that has been one of our ongoing topics of emphasis with the show.
Shelters just don't have enough help. Well, as we now try to gather all this in and conclude, what few comments would you like our viewers to remember about shelter medicine?
Well, I think just knowing that there are resources available and that there are now professionals dedicated to keeping animals healthy in shelters, and that there are so many wonderful resources for potential pet owners out there is very important. And I also think just what you said, reminding people to get into shelters. You don't have to take a kitten home. It's nice, but just getting in and having that time with the animals is such a big help, and it really enriches everyone.
It's a call for volunteers, right?
And if you can't volunteer, you can certainly
Send
help.
a check.
Absolutely. So, well, I tell you, we have covered an awful lot of
haven't we,
topics.
though?
I didn't realize, I guess, some of the things that you've talked about this afternoon, Bonnie, and we certainly really have appreciated you taking the time to, with you and Gidget, I should say, in sharing this information with us today. And I love the plea for the volunteers and the extra checks. I know money is hard right now. It's hard for everybody, but we can't neglect our little fur friends, if you will.
Exactly.
So, but we want to thank you so much for joining us today.
Thank you. It's been a pleasure.
And if people have some questions, we've told them how to get a hold of you. Again, would you give us that phone number, please?
Sure. Again, it's Flannery Veterinary Clinic, and our number is 898-9738.
Okay, well, and we, again, thank you so
for
much.
coming
And
for sharing
thanks
this
to you,
information.
Miss Gidget.
Yes, Gidget.
We look forward to seeing you again sometime. So
Doesn't time fly when you're having fun?
we never seem to get everything covered that we want, but,
No, but
that's the way it is. There's always more
tip
for
of the
another
iceberg.
show. Yes. And so, in closing this afternoon, Darlene,
I'm Darlene.
I'm Greg, and we want to remind our viewers, you've heard it from us before and you'll hear it again, give your pet a little extra love today
And every
day. See you next time.
Bye.